Thanks, Joanne. I really appreciate that. Appreciate the opportunity and the invitation to be here this morning. Talk a little bit about some of the things that we're working on at OCI, as well as some of the things that we're seeing in the healthcare market. Obviously, this year's conference is a little different than previous years, and I really appreciate everyone's willingness to be flexible and to adapt to the unique circumstances that we all find ourselves in as we are preparing for another open enrollment period. As Joanne said, my name is Nathan Hodek. I've served as the Deputy Insurance Commissioner since January of 2019. Prior to serving in this role, I spent close to 2 decades working in and around Wisconsin state government, worked in the state legislature for the Wisconsin Association of Health Plans and at a public affairs consulting firm, and really worked on a number of health insurance policy and regulatory issues in those various roles over the course of my career. And that background and experience has really served me well in my current role, where health insurance issues are really a large focus of the work that we do at OCI. So I'm going to spend some time this morning providing an update, as I mentioned, on some of the things that we've been working on here at OCI, as well as some of the things that we're seeing in the commercial insurance market this year and looking ahead to 2021 and beyond. I first want to start with some positive news, which I know is kind of a rare thing this year. But, if we step back a few years, as most of you know, the individual health insurance market in Wisconsin was not doing well in the early years of the ACA, and really through 2018, it had been plagued by instability, increasing rates, carriers leaving the market, just not good all around. But fortunately, starting really last year in 2019, we began to see that market stabilize. And that trend has continued into this year, and all signs are pointing to the trend continuing going into 2021. So from 2018 to 2019, we saw rates decrease by an average of about 4.2%. We saw increased service area expansion, and we also saw a new carrier actually re-enter the market. Again, looking from 2019 to this year, we saw rates once again decrease, this time by an average of 3.2%. Again, another carrier re-enter the market, and further service area expansion once again. And now looking ahead to 2021, the rate filings indicate that another average rate decrease with another carrier expected to enter the market, and once again continued service area expansion. That's assuming that all carriers sign their QHP agreements with HHS. But so far, things are looking very positive as we look ahead to 2021. And obviously this 3-year trend is very encouraging from the standpoint of increased competition and more coverage choices and lower average rates for consumers. We attribute much of this individual market stabilization to the Wisconsin Healthcare Stability Plan, which is the $200 million state-administered reinsurance program. As many of you probably know, this program was actually first conceived and created by the previous administration back in 2018, and it received federal authorization from the Trump administration to operate through 2023. Under the Evers administration and with the new leadership at OCI, we operationalized the Healthcare Stability Plan beginning in early 2019, and we made the first round of payments for eligible claims for plan year 2019 actually just last month. We continue to be encouraged that the Healthcare Stability Plan is having the intended impact of stabilizing the individual market, and we're hopeful that we will receive support for OCI's budget request to fully fund the state portion of the reinsurance program in the next state biennial budget. I know I'm going to take a little time to highlight some of the work that the DHS OCI Healthcare Coverage Partnership has been doing. This partnership was created by Governor Evers in summer of 2019. It's really focused on enrolling more Wisconsinites in high quality, affordable health insurance coverage. And the partnership is really, it's about improving coordination between DHS, OCI, and the numerous stakeholder organizations that support and promote consumer outreach, enrollment assistance, and overall well-being. And I know many of you who are participating in this conference have been involved with the work of the partnership over the past year. And for that, I want to say thank you for your involvement and support. And we've been encouraged by the work that we've been doing with the partnership, and we know that there's a lot more that we can and hopefully will continue to do. I won't go into detail on all of the activities that the partnership has been working on, but I do want to mention two recent specific initiatives. The first is the creation of the wiscovered.com website, which was launched earlier this summer. The new site is designed to connect Wisconsinites with free expert help to get health coverage. Information is available in English, Spanish, and Hmong, and it helps put people in touch with assistance from organizations like Covering Wisconsin, as well as United Way's 211 helpline. And it also includes information about how to access health insurance on healthcare.gov, through Badger Care, and other resources. Wiscovered.com was created as a mobile-first website, meaning that it was designed to work best on smartphones, really focused on Wisconsinites who don't have access to a computer or who may lack internet access at home. And we've really seen a positive engagement through Wiscovered, and we're pleased to be able to create this as yet another resource for people to access important information to get the healthcare coverage they need. Another initiative related to the DHS OCI partnership that I want to mention is the recent letter that was sent from Commissioner Fable and Secretary Designee Palm to Health and Human Services Secretary Alex Azar and CMS Administrator Seema Verma, requesting an extension of the ACA open enrollment period through January of 2021. We were also pleased to have 30 Wisconsin organizations, the Hospital Association being one, also including major health systems, insurance companies, prominent healthcare trade groups, local county health departments, and many other important stakeholders join with OCI and DHS in supporting this request. We all know with the significant economic disruption that's been caused by the pandemic, tens of thousands of people across the state have lost their jobs, and as a result, many people have lost their employer-sponsored health insurance coverage. And we know that it's critically important as a result to give people as much opportunity as possible to get enrolled in new coverage. And that's why we strongly support an extension of the open enrollment period. And we're very hopeful that HHS will look favorably on our request and will hopefully provide a response quickly. And one other topic I want to touch on briefly, and it's not directly related to enrollment, but it is a key issue in the broader healthcare landscape right now, and that's the issue of telehealth expansion. One positive, and I hesitate to say anything's positive, but one positive development from the events of the past few months is the extent to which we've seen telehealth be both rapidly adopted and accepted. Healthcare providers and payers have quickly adopted new policies and procedures for utilizing telehealth. Well, providers and patients have also generally accepted and embraced this rapid expansion. We continue to hear the saying that telehealth has essentially advanced 5 years over the course of 5 months due to the pandemic. And overall, there have been many positive aspects of this expansion. As more underserved communities and people who live in areas where access to a provider might be a challenge, they now have new opportunities to access the care they need. I will say, unfortunately, in the commercial market, Wisconsin is in a minority of states. We're really one of only 8 states that does not have any commercial market telehealth requirements in state statute. And the governor did try to address this, at least temporarily during the pandemic, and his COVID-19 relief legislation that he had introduced earlier this summer included language that would have required commercial market telehealth coverage during the pandemic and would have prohibited an insurer from denying coverage for a treatment or services that's provided by telehealth if that treatment or service is covered and provided in person. We feel that this type of telehealth parity make sense, and especially during a pandemic when people are hesitant to go get care in person, that it not just makes sense, but it's really needed. Unfortunately, that provision was not included in the final bill, Act 185, which was adopted by the legislature, but I do anticipate that there will be more, we'll see a continued push around trying to have some type of telehealth requirements or telehealth parity as we look to the next legislative session. And we do in general continue to see and expect to see telehealth expansion to be a hot topic across the broader healthcare landscape, both for the rest of 2020 and into 2021. And we at OCI, we do remain optimistic that we can really find ways to leverage telehealth to both improve access to care and also drive some savings in the healthcare system overall. As we look ahead to the remainder of 2020, I know there's not much left, but during the last 3 months that we have and looking ahead to 2021, we're really, we continue to try to work to understand what impact the pandemic might have and will have on health insurance and the broader healthcare market. We've seen rates in both the individual market as well as the state employee group health insurance program come in favorably for next year, which is encouraging. We've seen many insurers experience lower loss ratios due to many healthcare services being delayed as a result of the pandemic. But there are many questions about what will happen to rates and overall healthcare costs in the coming years as people start having more elective procedures performed again and providers potentially look to recoup revenue that had been lost due to the pandemic. And of course, as I mentioned, we've seen more people lose their employer-sponsored healthcare coverage, which we anticipate will lead to a shift to coverage in both the exchange and Badger Care. And we know the shift is already occurring in Badger Care. I assume that's probably something Jim will touch on. But we'll really have to see how the upcoming open enrollment period goes to really understand what that impact will be on the individual market going into 2021. So the reality is, at this point, there are more questions and more unknowns than there are answers. But we, at OCI, we continue to keep a close eye on the healthcare landscape and working with other insurance regulators and other healthcare stakeholders to do everything we can to be prepared for what the future may look like, both next year and beyond. So I guess with that, I'd like to close by saying thank you to all of you for the work that you do. It's critically important that we continue working to ensure that every Wisconsinite has access to affordable healthcare coverage, and each of your efforts are really an essential part of that ongoing effort. We know that the disruption caused by the pandemic has had a negative impact on healthcare coverage for many of our fellow Wisconsinites, and we really need to step up our efforts to provide education and enrollment assistance for those who have been negatively impacted. So again, thank you for participating in this conference. Thank you for all the work that you're doing. Appreciate the opportunity to be able to join you all this morning, and I hope you enjoy the conference. So with that, I guess, Joanne, I will turn it back to you.
Great. Thank you, Nathan, for all of those terrific comments and setting sort of a good understanding of where OCI is. So what I would say is that I want to make sure that folks know that they can submit questions through the chat feature. Just remind you to do that. And I think we are going to have a polling question, although I haven't seen it up yet, but I'm sure that will be coming very soon. So maybe to kick off the questions, though, Nathan, my question is really more around timing. And I know that every year, particularly folks who are out gearing up to help people get enrolled in coverage are very interested in some of those shifts that you talked about, the changes in, are there insurers coming into new counties? Are some insurers changing, maybe pulling out? It doesn't sound like they are. And what kinds of coverage are going to be offered? And often, and I think it's due to federal government timelines, that we don't get to see that information until kind of really close to open enrollment. Can you help us just understand the timing of that and when we might expect to be able to access that kind of information as folks are really sort of gearing up to help in their communities?
Yes, good question, Joanne. Thank you. So, and you'll forgive me, I always forget the exact dates, and I don't want to give a date that's not completely correct, but I know I think it's the second week of October is when we typically are able to make the public announcements and put out the information about the service area expansion and have the confirmation on which carriers will be in each county and in the regions throughout the state. We try to get that information out as soon as we can once it has been finalized with the feds. We've started creating, I think this goes back a few years, but doing kind of a year-over-year heat map showing by county how many additional carriers. And then also on the OCI website, we do have an interactive map where people can go to the county in which they live, and it will show the carriers that are available in that county. So it should be in the next couple of weeks. Again, I apologize for not having the exact date, but we will get that information out publicly as soon as we can.
That's great. Thank you. Really appreciate that. So the polling question is out. And the question for our audience is, have you assisted a consumer with a marketplace special enrollment period so far in 2020? And you can answer yes or no or can't remember, just click the button. And so on that note, I guess a second question is, Nathan, you talked a lot about the pandemic and the issue with people losing their employer coverage and needing to find coverage elsewhere. I'm sure Jim will talk about the Badger Care Medicaid enrollment numbers. Have you seen much in terms of special enrollment in the individual market?
No, we really have not yet. Been, I think, a little surprised by that, and I think that's fairly consistent. I hesitate to say fairly consistent across all states, because I know other states that have their own state-based exchange have created state special enrollment period, have been more aggressive with outreach, where we're a little more limited because we're a federal exchange. But so far, to answer your question, Joanne, we have not seen a significant uptick in individual market coverage.
So that's why you're saying we'll kind of see what happens with the next open enrollment period.
Exactly. And we are, I think our internal numbers are projecting that we likely will see an increase, but at this point, a lot of that it's speculation, like with anything else. So we'll really have to wait to see once the enrollment period has ended and the coverage is effectuated.
Mm-hmm. Great. Okay, that's helpful to understand. And so, Nathan, you might not be able to answer this question, but one of members of the audience asked, when will we know about the extension of the open enrollment? With the letter that you mentioned that you all, the partnership and the organizations that supported that, submitted to the federal government.
From our standpoint, we're hopeful that we hear as soon as possible. I know that obviously it makes planning difficult when we don't know. The letter, I think, was submitted last Thursday. So it's just going to be a matter of how quickly we can get a response from HHS, and we're confident and hopeful that they'll get back to us soon.
Great. And then another question from our audience. Do you know much yet about what deductibles and out-of-pocket might look like in the coming open enrollment period, I suppose, is maybe compared to the last year or two?
Yeah, I believe that has to all be finalized before we can share all of that. So not able to share that at this point.
Okay, got it.
I did see a question come in about the WIS covered website, and it's spelled just like it sounds, WISCOVERED.com, wiscovered.com.
Yep, and I think that was in the chat feature, it's spelled out there for you. And then there's a question on the status of short-term plan complaints and issues. Someone says that they are seeing more complaints about that.
And we are monitoring those closely, as are, I know, other insurance regulators across the country, and working with the NAIC. There has been an increase around short-term limited duration plan activity. I don't have a specific update other than to say, that is fully on our radar. It's something we are closely monitoring. Whenever we do feel like there's a problem that, from a regulatory standpoint, we need to take action on, we do and we will. Obviously, our state law, we have to abide by our state laws when it comes to our regulatory authority. And so we always have to keep that in mind in terms of looking at, when a short-term plan is actually violating a law or doing something that would allow us and require us to take some action. So it's a long way of saying we're aware of these plans in the market and keeping a very close eye on them.
But consumers are able, if they're having concerns, they're able to file complaints with OCI on those plans.
Yes. And that's a good reminder. I would say, if anyone knows of anyone or is working with someone who feels like they are being misled, or there's some deceptive marketing, or anything that would it should be reported to OCI from a complaint standpoint, encourage them to file that complaint, and our office will look into it and do everything we can to address it.
Great, thank you. Have other states been granted extensions on the open enrollment period that you're aware of? I think would be a federal extension that we're asking for. Or do you have knowledge of how many, or if other states have submitted requests for an extension?
That's a good question. I'm not aware of any other states that use the federal exchange that have been granted extensions. Obviously, those states that have state-based exchanges do have more ability to do a longer enrollment period, but I'm not aware of any of the FFE states.
Okay. And then I think this is a really kind of good reminder for everybody. And it's really a question about letting people know that, regardless of the Supreme Court's decision on the ACA, that it will not impact plans for 2021. I think it's a good reminder for us, one, to verify that with you, that that's your understanding as well. But also, I think the question is, what kind of outreach or what kind of effort can we make to ensure that people know and understand that?
That's a very good point, and I think it's something that everyone who's in an official role in terms of doing outreach and talking about healthcare and the broader healthcare market needs to just let people know that the ACA is intact right now. Everything is going forward as planned. Nobody obviously knows what's going to come about as a result of the lawsuit, but we all have to continue moving forward as if things will continue to be as they are, that the ACA is there, that the marketplace is working the same. And until we know what that ruling looks like, it's status quo.
I feel like we've had that issue for a few years.
Exactly.
Over the years, we've always been concerned about an upcoming Supreme Court decision, but that message seems to be the same, that regardless of what happens, sign up for coverage, and it shouldn't impact the plans for 2021.
Exactly. And Joanne, I do have to get off. I have another call to jump on at 10.
Okay.
If there are other questions, and I saw some coming in, if Allison or whoever would like to just email those to me, and we will work to get responses, get those back to everyone as quickly as possible.
That would be great. Nathan, thank you so much for being with us today. Really, really appreciate all of your comments and your good answers to these questions. So have a good rest of your day.
Thank you, Joanne, and thanks again for everyone for participating. Have a good day.
Thanks. Bye-bye. Okay, so that was very informative. Always great to hear from OCI. And now we are going to turn it over to Jim Jones, who is our current state Medicaid director at the Department of Health Services. Hi, Jim, and welcome.
Hi, Joanne. Nice to see you. It was great working with you all these years. We'll just keep doing that. Joanne's great. Thanks for everything. I'm going to share my screen now and go through a presentation for everybody. Hopefully you'll be able to see it. Just so everybody knows, if you're on here and you're somebody who's going to be presenting probably from the Department of Health Services over the next few days, I'm going to steal all your thunder all at one time. And just, we're all going to have to get used to it. So I'm going to talk a little bit about Medicaid beginning in 2020, but beyond that, and give you more of a sense of where the program's going as well, just so we're all on the same page. That said, okay, I have to be able to do this. Let's see if I can. Okay, why are you around? There we go. That didn't work. Hang on. We're going to get there. Try and keep myself moving forward. There we go. We're going to start off by looking really forward where we plan on taking Medicaid over the next years. A little look back on this year. It's been interesting. I guess that's the nicest thing that I could say about it. As we described it yesterday, it's been a big old bag full of bobcats. We're also going to talk about long-term ripples of the pandemic and what that could mean, and some other projects that we want you to be aware of as we move forward. Medicaid in Wisconsin, let's talk about where we're going. Our plan, as we've been working on it, and we've been working on it now for 2 years, is really create a seamless delivery system that's very equitable. We have a lot of racial and ethnic disparities when it comes to health outcomes and healthcare in Wisconsin. We are coming up with a plan and have been implementing a plan that focuses on making our system and the way that we address everyone in the state as equitably as possible. We have horrible racial health outcomes in the state. We want to address those. We also want to make sure that we create a person-centric program. What that really means is putting the person at the center when it comes to choice, having them be the one who makes the choice in their enrollment process, having them be the one who is really making the choices about what care they're going to receive. And we want to do that so that person can live their best life. We are not always concerned with health outcomes. That's a very big part of living your best life. But we also want people to be involved in setting goals for themselves, really looking forward at how they want to live their lives and do the best they can. We also want to make sure that we're always culturally competent. We'll be putting in the class standards over the next year and continue in the future. And we want to make sure that we have a simple and to understand and navigate process. We don't have one of those right now. People have a hard time with our system navigating around. If you've ever known someone or been someone who has a child with special healthcare needs, it's difficult to find the right providers. How does this all fit together? We want to make that a more easy to understand and intuitive system to navigate. That's where we're heading. Right now, we a few days ago, we actually officially restructured the Division of Medicaid Services. We're really going to be organized around some key principles and goals. Really, we're more than 70% of our members are in managed care, so we're trying to be more aligned around that model and less on the fee-for-service side. We want to really integrate and have a complete focus on holistic health and health outcomes for our members. Again, we want to support person-centric care and really put our members at the center of their care model. And we want to also make sure that our programs are simple, intuitive, and prone equity. So we have groups that are working on these models right now, and we will be moving forward with them. Our initial focus areas, as we've talked about them in 2020, are really the inclusion of equity considerations and decisions across our entire program. That means both internally and externally. I'm in the process of putting together a position that'll report directly to me that will be an equity and inclusion policy initiatives advisor. And I want that particular person, again, reporting to me and talking about all the things we're doing in the division to make sure we get some of these, some of the systemic racism that is part of our public program. Also, we're going to be focused on HMO quality and contract reform. Again, we've actually restructured in a lot of ways to support more of a managed care compliance model that will make sure that we hold our plans accountable for achieving the outcomes that we expect. We are looking in the next two bullets that you see here. We really want to make sure that we have the capacity and access in the future for our population as people get older, as people reach ages where they are more physically disabled, and of course for those people who have intellectual and developmental disabilities, to make sure that we have a long-term care system out there that is available for them and supports them in the situation that they want to be. We're a state that does a great job with long-term care, and really have a good continuum of care models across the state. We just received word that we are the third best long-term care system in the country, as judged by the ARP. And finally, we want to make sure that our long-term care system is fiscally stable. Family care has kind of been all over the place the last few years. We're trying to come up with a model that's a little bit more consistent fiscally over a longer period of time. And we don't have as much fluctuation in our market. Now, here we go, keep moving. Let's talk about 2020. The first thing you should know that back in March, we actually moved 95% of our employees to remote work. We are still in a world in which we are remotely working. You can see I'm in my home office right now. We are also identifying a number of policies, and we've implemented a lot of policy changes to keep our members and our providers safe and served. We have implemented telehealth in all synchronous situations already. We did that in April. So basically, any service that you could receive in Medicaid that you can receive, that you could have received in person, that if there is an equal telehealth version of that service, we are allowing it and we are paying the same for that service. We also exempted all of our members from the Food Share Employment and Training Program. We have actually exempted all of our members through September of 2021. We were allowed to do so because our unemployment rate got that as high as it did. So no one is mandatory for the FSET program during the pandemic and beyond. We have loosened and made more flexible our prior authorization rules for when providers have to ask for permission to provide services to make that easier. We've done that not only in our fee-for-service environment that we run, but also told our managed care plans that they have to do the same thing. We've tried to make it easier for providers to enroll in our program. Specifically with telehealth, we have providers who are not enrolled in our program that our health systems are looking at them and saying, hey, we need help doing telehealth. Can you help us out? We want to allow those providers to get in a much easier fashion. So if they're Medicare enrolled, we are enrolling them and doing our background checks after they're enrolled. And we've also tried to make member enrollment easier across the board and actually try to keep members enrolled. And we'll talk more about that in the next slide. When it comes to federal emergency efforts, about when it came to the pandemic, that the Secretary Azar, the HHS Secretary, declared a public health emergency. That has actually been renewed multiple times, and now it's scheduled to expire at the end of October 25th, 2020. We expect that to be renewed. We don't have any special information about that, but considering what the election is coming, we think that it's a safe assumption to think. We are planning for both eventualities, either an extension or not. We'll talk more about what we have to do when it comes to the public health emergency ending shortly. There were two pieces of federal legislation so far, one called the Families First Coronavirus Response Act, which I think we are calling FICRA, and the other is the Coronavirus Aid, Relief, and Economic Security Act, which everyone calls the CARES Act. If you look at what we've been doing, we actually applied for a number of waivers. We were allowed in a public health emergency to apply for waivers of Medicaid federal law and regulation in very specific areas. Those are called Section 1135 waivers. They are in effect for the duration of the public health emergency. They're also what are called Appendix K waivers, weird names, right? Those are for our home and community-based service waivers. Those actually go longer. Those will go well into 2021. They're actually in effect for 12 months. And we also can submit what we call disaster state plan amendments that'll give us even more flexibility. And literally, we spent about 2 months working with CMS to figure out which ones we could do and which of these three methods we had to do to get those kinds of flexibilities. And some of those flexibilities were things like what kind of inspections have to be done in hospitals, what kind of inspections and fire, all sorts of sort of infrastructure things around nursing homes and hospitals that couldn't be done. Elevators couldn't be inspected during a pandemic because it added the risk of infection. So, those kinds of waivers were included, but we also included a lot of things to make sure that we could do our business remotely and using things like telehealth, using things like automated enrollment, anything we could do to make it easier for people to get on our programs, stay on our programs, and receive the services that they need, even when much of the healthcare system was shut down from physical visits. Now, because of changes that were made at the end of the last administration, we actually had to ask for permission from the legislature, and they had to get back in place to provide us with those statutory changes, so we're actually allowed to apply for these waivers and receive them. That's a big deal because one of the things that the Family First Coronavirus Response Act did is it gave us additional money. They actually gave us an additional 6.2% of federal funding for all of our Medicaid benefit expenditures during the public health emergency. That's a big deal because it actually ends up being about $150 million of extra money that the state would have to spend on Medicaid in each quarter. So to date, because this went back to January 1st, the state of Wisconsin has been eligible to receive an additional, and this is an estimate, about $600 million in additional federal money. That was a big deal for us, and it's really helped out the state. Without it, we would definitely be in serious financial trouble. There were some sort of high-level policy and regulatory changes I wanted to hit on. As part of that enhanced federal matching that I just spoke of, states were required to maintain what they call a maintenance of effort, which meant that we could not disenroll anyone from Badger Care or from Medicaid, period, until they either requested that they went and left the program or they moved out of state. Otherwise, their income went up, whatever reason we had, they didn't give us verification, whatever it was. In Medicaid and Badger Care Plus, we could not terminate their eligibility at all. This meant that we postponed all of our renewals. Right now, we're going to have about 9 months of renewals that we're going to have to catch up on next year that we'll have to spread out over the course of the year. The second thing I'd tell you is we really changed our verification requirements. So we went with best available information. Listen, your employer is closed. I don't need, you can't get your payroll information. We'll take the best available information. And that will continue as long as the public health emergency is in place. We also suspended all premiums, the Badger Care Plus premiums for children, the Badger Care Plus premiums for childless adults, and the Medicaid purchase plan premiums. All were suspended for the duration of the public health emergency. We also suspended, as part of this is the treatment needs question that was part of the Badger Care reform program that was implemented in February. We suspended it because it would have meant that we had a more restrictive policy in place when we began to receive this extra federal money from the beginning of the year. And that is strictly forbidden by the federal law that they put in place. We also exempted all the work requirements for the Medicaid purchase plan, which is that program for the working disabled. And we put in place presumptive eligibility for people who are elderly, blind, and disabled. It has made some difference. That one probably being sort of not one of the ones that has met the most, but I would tell you, this is kind of almost in order of impact as we look at it. Now, we are right now in the midst of planning for the emergency's end. It feels like I know how many new cases were reported yesterday. I know about hospitalizations, but no matter what, we always are planning for the future. And so we are looking at what we have to do when this emergency ends and how much time we actually have. So there will be a rollback of some of these flexibilities. You should know up front, some of the things with telehealth and some other places, we're probably not going to roll back all the way. We're going to keep a lot of those flexibilities. Anything that we would be allowed under regular federal law and regulation and guidance, which CMS has provided us even more flexibility, we're going to keep those kinds of flexibilities as long as we can. We are going to have to come up with a process to deal with the end of enrollment. There are a bunch of people who've reported income and they're not eligible anymore. They haven't provided verification, or a number of things can happen. In those instances, we are going to have to come up with a way of dealing with that over time. We know that it's not something we can do in a day or a week or a month. It will take several months to get through. When you have 9 months of renewals, you can't do them all in a month. What we will have to do is we will have to spread those renewals out over a longer period of time. And I'm guessing that will be 6 to 9 months probably. The great thing is, if the public health emergency gets extended again, it'll have been a year and we can just sort of pick up the regular renewal process when it rolls around. But we'll see what happens. The other thing that we are trying to do is we're trying to provide opportunities to transition to the exchange or private options as people, maybe they made more money, maybe their household size decreased, whatever it would have been. There are going to be people who are going to move up from below 100% of at or below 100% of poverty above that. And we want to make sure that we provide them an opportunity to transition to the exchange. So we have to go through all those account transfers that we normally have with a federally facilitated marketplace and move those forward and make sure that we handle those. And we want to do that over time so that we don't overwhelm our system, don't overwhelm our members all at one time. And all of this is in an effort to avoid gaps. So we want to provide people with the opportunity before we end their eligibility, because they reported a change, to report different information. So that there's going to have to be some creative approaches to how we do that. We're working on that plan right now. At this particular point, communication to all audiences, we got to make sure everybody's online. We got to make sure our counties and Miles and the people, our members, the health plans, providers, all of you are understanding what we're doing and what we're going to be doing as part of anything we do. We're always worried about communicating as clearly as we can, and we're trying to always do a better job of that. To continue a little bit, let's talk about the Medicaid trends. I'm not sure what you can see on your screen, but what we've seen is about a 200,000 person increase since January. And you can see that it started going up really in April, as we would expect, and it has continued to increase. It has not increased at the level that it did in 2009, 2007, 2009, the so-called Great Recession. And so we are interested in that. We are tracking it very closely. When we talk about our budget request for next year, we are using the 2007, 2009 historical information. We think that, and this has been true, I've been talking to other state Medicaid directors, not all of us are seeing this increase in the number of people who are applying for and becoming newly eligible for the program. A lot of this increase is the continuous eligibility issue of people not leaving the program. So just be aware, we are seeing an increase, 200,000 people. It's a lot. We expect to see an even higher increase in the future when people feel more safe to go into healthcare settings, but also to apply for benefits. So we'll see how that goes, but we are expecting a much higher increase than this. Budget impacts, again, an expanded caseload. If you look at our budget request, 85 to 90% of it is an increase in caseload. The rest of it is some acuity adjustments that we're seeing as well. We did put it in the budget request. It was a large one, but that request was strictly based upon really our base reestimate and what we think we need to do to address that. It was, I think, $1.3 billion in additional money for Medicaid. But at the same time, we also included Medicaid expansion. If you do Medicaid expansion at the same time in the next budget, you can reduce the amount of money that would need to be spent on that base reestimate by about 600 and I think it's about 600 to 650 million dollars in additional federal money that we'd be eligible for by covering more people, covering adults up to 138%, because we get that better enhanced federal matching if we follow the Affordable Care Act's Medicaid expansion option, which Wisconsin has not done up to this particular point, but it was included in our budget. We also, as we look at any kind of deficit, in 2007, when I was here the last time, we were handed a $600 million reduction in the program that was unspecified. What we started off with, and what I wanted to start with, is we want to minimize any effects on eligibility groups. We don't want to balance our budget on the back of low-income individuals and families. We want to maintain access to services. We want to limit the impact on rates. And we want to work with all the stakeholders, advocates, provider groups, et cetera, to figure out how we would deal with any kind of reduction that we would need to find in our budget in 2021 to 2023. It worked the last time. I think it can work again. The idea is we probably all have a lot of ideas that we can share with each other about how we can reduce our costs without really affecting rates, access, or our eligible people. So that gives you an idea there. There are some long-term ripples that we're going to see. Telehealth is the number one. We did get a change in law back in December that required the Medicaid program to move into telehealth. We're planning on doing that over 9 to 12 months. We basically did it in 3. COVID was really the jump start that happened to that. We are working really hard to gather feedback on telehealth from members and providers. I'm concerned that in some ways telehealth could increase racial health disparities and ethnic health disparities because of the digital divide and people lacking access to either broadband or to data plans and data minutes in order to use telehealth. We want to make sure that doesn't happen. We're working on ideas to try and minimize that divide. We are going to keep many of the changes in telehealth. We're going to keep expanding it. We've already implemented in the last month doctor-to-doctor consultation, and we are also working on additional guidance for asynchronous, which is texting and chatting and sharing photos and telemetry with your provider in the future as well. The pandemic EBT, I don't know if you're aware of this, but the state of Wisconsin elected with help from the USDA to provide additional benefits during the pandemic for kids who were eligible and enrolled in the free and reduced school meal program. We did that for, I believe, March, April, May, and June. There are changes that the FNS, the USDA Food and Nutrition Service, made to this program if it was going to go forward in September. And they are changes that with our system, with the data, the way that we provide data, would make it very difficult for us to continue the program. We're trying to work with our congressional delegation to make sure that moves forward and it can be changed in a way that makes it easier for states to implement. We are, of course, at the point where uncertainty is the new normal. We're watching our trends in enrollment. I literally watch it on a daily basis. The pandemic period and the post-pandemic economic recovery is really where we expect to see a lot of our applications come in. I can't tell you, I don't have a clear picture of where we're going to go. This is like nothing I've seen in the past. Been doing this for a long time. I've been through, I think, 4 or 5 recessions and seen huge increases in enrollment. But I've never run a course like everybody else, right? None of us have really run into this unless you're around for the influenza epidemic of 1918. So we're really looking with our federal partners, with other states, to find as much flexibility and creativity to whatever happens and dealing with it the best we possibly can. We're trying to, sort of go through the various scenarios and determine what we can expect. Okay, just some ongoing projects that we have out there. I want you to be aware of them. We are early next year, we'll be putting a residential substance use disorder benefit in place that was delayed for a year as we worked with our provider stakeholders to make sure that it met their needs more accurately. We're also going to have a substance use disorder hub and spoke pilot program that's going to come out early next year as well. We have gotten applications. We're about to announce the 3 pilot programs that we've selected and will begin working on. We are making major updates to the way that Access, our digital platform for eligibility and enrollment, looks. We're also looking very closely at My Access and making substantial updates to that smartphone and tablet-based app so that people can interact with our program digitally in the best way possible. We will be adding a number of different new enhancements to My Access over the coming year. I'll be there in 2 seconds. Give me 1 second. Suspension, not termination for members incarcerated. The Medicaid purchase plan reforms will be put in place this fall, and we're continuing to work with our friends at OCI and all of you on the health insurance partnership. I want to thank you all for all the work that you do on this. Please keep thinking of new and creative ways that we can really help eligible consumers apply and stay enrolled in our program or in QHPs in the marketplace. So I thank you for this time, and I'm willing to take a few questions.
All right, Jim, thank you for the great information about what the department is doing. Lots of great work under your leadership. So thanks for all of that. We do have a few questions, and I am going to kick it off. It's similar to one of the questions. There's a question about, is there discussion of providing information to members leaving Badger Care or Medicaid on how to find local assistance or providing information for local help rather than just to the marketplace? And that led into my question, which was, as you're looking at transitioning people off of Badger Care or Medicaid, what role would you like the enrollment assisters to play? What role can we all play in helping ensure that people transitioning off are finding coverage?
Number one, we want to make sure that we're making the right referrals, that we make this information available. I think that resources like wiscover.com are going to be very valuable. We've been working with our friends at the Department of Workforce Development to get some links to Access and My Access linked added to the unemployment insurance page. So when people are applying for unemployment insurance, they're also aware that they can apply for Badger Care and continue to get health insurance. So we're continuing to do that, and we want to continue to work with the group, the OCI DHS outreach group, to identify other ways that we can use our data to identify people closely. I'm ready for everything else.
Yeah, so that's great, because I know that Covering Wisconsin is a part of that group. We're a part of that group. Lots of the folks who are listening are part of that group. So really appreciate that. How and when do you anticipate that the treatment needs question and community engagement requirements for Badger Care will be rolled out once the maintenance of effort is no longer in effect?
We figure it'll take about 2 months after the public health emergency is over. So if it ends at the end of October, we're talking probably the beginning of the year. If this doesn't end until February, we're talking about April of next year. We are required to put it back in place again, along with premiums. But again, the premiums will be like we started up from the beginning, and it'll take us a couple of months to get that moving again.
Okay, that's helpful. And did you say in your presentation that there is some discussion that the public health emergency will be extended again?
Yeah, we think so. I mean, they usually wait until almost the last minute to tell us this, but we were just thinking it's the federal government doing it. It's October 25th. That's like, 10 days before the election. Probably maybe not something that they do. We'll wait and see. We're prepared for either eventuality. I'd love to see it extended until next year so that we get an additional quarter of additional federal match, but also continue these flexibilities. The pandemic's not going away. It's getting worse right now.
Right.
So we need these flexibilities now as much as we've ever needed them. And we want to continue to head in this direction. But we'll find out from Secretary Czar in late October about what's going to happen.
Great. Okay, thanks. Will the substance use disorder benefit expansion cover room and board?
Unfortunately, we are prohibited by federal law and our waiver from paying for room and board. But we have asked in our budget request to the governor to include state money that could be used to cover room and board in the new budget for the 21-23 budget. We also are working with our county partners who are paying for this benefit right now to see how we can sort of braid this funding and have them pay for that portion of the benefit while we are paying for the actual treatment portion. But again, the federal law and our actual waiver prohibit us from paying for room and board for this particular group. If there's a change in administration, we'll ask for something different. But right now, that's pretty much their position.
Well, appreciate your continuing to try to find creative ways to work on that issue. What is the lever that Medicaid is using to move to suspension of coverage instead of termination for incarcerated individuals? And when might that be implemented or effective?
When we say lever, I'm not exactly sure what you mean. The Support Act that was passed by Congress a couple of years ago actually does require states to move to this model. Wisconsin was already moving in this direction. The idea that when someone goes into prison or jail or any incarceration situation, that they lose their benefits is not a good thing. It's something that ends up meaning they have to reapply when they're leaving prison or jail. And that can mean a delay in them getting benefits. If they don't get their benefits, for some of them, remember 70% of our imprisoned population has a behavioral health problem. It means that they don't have access to the services and things like pharmaceuticals that they need to continue to live a good life. And it results in recidivism when they don't get it. So we are all behind this, and it will be implemented in the October release. So I'm not sure, I'm not there yet, but I'm going to get there soon. So we'll be there in October, and we'll put that in place for, it's a first phase. It's for people in prison, state prisons and federal prisons, but not for jails. That'll be phase 2 that we'll get to.
Okay. So it looks like we're going to go for one more minute because the polling question has just been released. And folks have about a minute to answer the question, now almost 30 seconds. Since the pandemic shutdowns began in March, what best describes your enrollment assistance caseload? So please check out your question and submit your answer. There was another question in the chat. There were a couple I think I missed. One was, if or maybe could the transition letter for people being removed from Badger Care Plus due to higher income, could that have the 60-day rule explanation in terms of days to apply for Marketplace?
Yes, it can, but also remember that we send our accounts for people who are above the income limit. I think that's a great suggestion. Let me start off there. Great suggestion. Something we'll talk about and see if we can include. At the same time, remember that when we have somebody who goes over income who looks otherwise eligible for the Marketplace, we actually send their information to the Marketplace. So we would do that.
Great.
Oh, it's all over the place.
It is all over the place in terms of the responses to our questions. So thank you everyone for your responses. There are a couple more questions, but seeing that we're at time, I think what we'll do is the same that we did for Nathan, which is we'll collect any additional questions and get them sent off for responses. Joy says, thank you for the information. So I'm going to reiterate that, Jim. Thank you so much for the information. As always, great to hear from you.
And any questions that we get that relate to the other presentations that are going to be done for this conference, we will send those off to, I'll make sure they get them so they can answer them during their sessions additionally.
Sounds good. Thank you so much. And with that, I'm going to turn it back to Allison.
Yes, thank you so much, Joanne and Jim and Nathan, and thank you for being here. Great first session. We are going to go ahead and take a short break. We'll reconvene here at 10:45. So this gives you a chance to just stretch, do whatever you need to do. You can keep the link open and no need to reconnect unless you want to. And yeah, we'll see you again at 10:45. All right, thank you.